HIV-positive children who are heart-naive, slow progressors. So this study is currently being conducted at the University of Cape Town in South Africa. So our preliminary data examine the neuroimaging and neuropsychological signatures of clade C amongst 10 slow progressors between the ages of 8 and 12 years, compared to 10 children who are matched for age from the same low socioeconomic community. So slow progressors can be defined as children who are vertically infected with HIV, but remain clinically and immunologically stable for a long period. In the research literature, they're defined as having received no or minimal therapy, defined as single or dual nucleoside therapy, before the age of 10 years, and have maintained a CD4 count above 25%. So in South Africa, as many as 35% of all infected children are believed to be slow progressors. Yet little information is known about this group in terms of their neurodevelopment. There was a recent review by Abu Bakr in 2008 of the neurodevelopmental studies done on HIV-positive children in sub-Saharan South Africa. And in that review, he highlighted the paucity of data on older vertically infected HIV-positive children. And this is even more so for children who are asymptomatic or slow progressors. There have been a study on this group in Uganda in 2006 of children between the ages of 6 and 12 years who were asymptomatic, vertically infected, and had never received any antiretroviral treatment. They scored slightly lower than controls, but still scored within the average ranges of neuropsychological tests. They used the Kaufman and also measures of reading, spelling, and arithmetic. So the only significant differences between the controls, who were matched for age, also from the same low socioeconomic community, and the HIV-positive children, was that the HIV-positive children were significantly poorer in their reading scores. So despite children being defined as asymptomatic, HIV infection can still have an impact on the central nervous system, causing deficits in specific cognitive domains, and hence the importance of investigating these domains, as asymptomatic children may have been classified as such due to their scores on global measures. So our aim was to define the neurocognitive and behavioral outcomes of these 10 HIV-positive children who were defined as slow progressors and who were heart-naive, compared to 10 HIV-negative children. We also defined the fractional anisotropy and mean diffusion of the corpus callosum, the superior longitudinal fasciculus, and the internal capsule as measured by diffusion tensor imaging. So 10 children who met the criteria for slow progressors and who were heart-naive were recruited from Red Cross Children's Hospital in Cape Town, and the controls who were HIV negative were drawn from the same low socioeconomic community as the HIV-positive children. And the two cohorts were compared on measures of neurocognitive assessment, a behavioral questionnaire, and diffusion tensor imaging. So our neurocognitive assessment consisted of neuropsychological tests that are standardized with sound psychometric properties and are commonly used in pediatric neuropsychological research currently in South Africa. There are two studies currently underway in Cape Town, one with children who have experienced traumatic brain injury, and another with children who abuse alcohol and methamphetamine who are using the same battery. And these tests have all been translated and back-translated into Xhosa. So we used measures of general intellectual functioning, motor functioning, processing speed, attention and concentration, working memory, visuospatial processing, visual memory, and executive function. We compared the two cohorts on behavior using the child behavior checklist, and this requires the parent or guardian to rate the child's problem behaviors, and this instrument is suitable for use in children between the ages of 6 and 18 years. So in our diffusion tensor imaging, our diffusion-weighted images were acquired at the Cape University's Brain Imaging Center on a Siemens Magneton 3T Allegra. We used 30 diffusion directions and repeated the sequence 3 times to acquire an average image. The images were analyzed using the tractal-based spatial statistics, which is part of FSL. We also used MATLAB. So the FA image was thinned to create a mean skeleton, which represents the center regions for these white matter tracts. We used a motion correction sequence, being children, which we obtained from Prof. Anesta Meintjes at the University of Cape Town. And we did also correct for multiple comparisons, and age and gender were introduced as confounders in the analysis. So in terms of the demographic data, the groups were well matched and homogeneous. They were all right-handed, all participants had home language of Xhosa, and there was no statistically significant differences in sex, and all the participants were defined as being of low socioeconomic status. This mean CD4 count was 585. So this table highlights that there were no significant differences in age or in education between the two groups. And this table highlights the between-group differences on our neuropsychological test battery. Oh dear. Sorry, it was okay on my laptop. I apologize for this. So I highlighted the areas that were significantly different, and these were both the verbal and performance IQ in general intellectual functioning. The groove pegboard test tended towards a significant difference but didn't quite reach significance. The other significant differences were in visuospatial processing and in a semantic fluency in executive functions. So in terms of the behavioral disturbances amongst our HIV-positive children, the asymptomatic children experienced more difficulties at school, and these difficulties were repeating grades, attending special classes, and having problems with schoolwork. And our parents and caregivers reported internalizing behaviors in the clinical range, and these behaviors were commonly somatic complaints, withdrawal, and depression. So this cohort seemed to experience more internalizing behaviors as compared to externalizing behaviors. In terms of our diffusion tensor imaging results, there were no significant differences in mean diffusion in the 3 regions of interest. However, there was a significantly reduced fractional anisotrophy in the regions of interest for the HIV-positive children compared to those who were negative. So we saw differences in the posterior body of the corpus callosum, the superior longitudinal fasciculus, the genia of the corpus callosum, splenium, and both the posterior and anterior limb of the internal capsule. So this slide represents the visualization of the brain regions that were significantly reduced in the HIV-positive cohort. So the clusters that are highlighted in blue are those where the HIV-positive children were significantly reduced compared to the controls. Then we correlated our white matter integrity with our neuropsychological test performance. Again, looking at the 3 regions of the corpus callosum, the internal capsule, and the superior longitudinal fasciculus. So in the corpus callosum, semantic fluency, poor performance on semantic fluency predicted poorer white matter integrity in this region. And in the internal capsule, color trails and the ray complex figure predicted poorer white matter integrity. And the superior longitudinal fasciculus, again, semantic fluency was predictive of poorer white matter integrity in this region. So in conclusion, our results indicate that cognitive function and white matter integrity, as defined by diffusion tensor imaging, is altered amongst asymptomatic HIV-positive children. Specifically, fractional anisotrophy, but not mean diffusion, is altered amongst our asymptomatic children in the superior longitudinal fasciculus, the corpus callosum, and the internal capsule. The asymptomatic children performed poorly on performance and verbal tasks of the WAIS and on tests of visuospatial processing, visual memory, and executive function. Furthermore, parents and caregivers reported internalizing behaviors in the clinical range. Thank you.